one additional thing that I talked about, I didn't fully mention, I forgot. So one of our research fellows, Michael Sun, is presenting an abstract in the prostate cancer poster session about long-term toxicity. So it's an unknown entity. Number one, this is relatively new. Especially outside of New York, it's really 5 years or so. Unfortunately, patients that are treated are typically heavily treated and don't necessarily live on average a long time. Although luckily we now have patients that have lived more than a decade. So anyway, Dr. Sun put together some data with longer term follow-up. These were non-randomized trials, so there's no control, and patients had to live long enough to be able to be analyzed for long-term toxicity. So those are some of the caveats. But what it looks like is that there is not a lot of long-term toxicity. So when we looked at AEs on a long-term basis, there are some that, for instance, might have an elevated creatinine or might have anemia or thrombocytopenia, but the vast majority have some other explanation, like an obstructing tumor, dehydration for creatinine, or getting chemotherapy, which is why they're thrombocytopenic or neutropenic or whatever else it is. Although we can't discount the effect of the prior therapy. So anyway, it's an initial data set that's relatively unique because there is long-term follow-up, and there's not a strong signal, luckily, of major long-term toxicity, but I do think it's important as we treat earlier populations to do it in a systematic manner and include long-term follow-up.